Let's talk about something most people feel too embarrassed to bring up. But let's be honest, it's quietly on the minds of many older men. Have you ever wondered what daily masturbation really does to your prostate? Some people say it's harmful. Others swear it's good for your health. So, what's the truth? If you're a man over 60 or someone who loves and cares for one, this topic matters more than you might think. Especially when it comes to prostate health, urinary issues, and yes, even cancer risk and the real science. It might just surprise you. Hi there, and welcome back to the channel that puts your health and wellness first, naturally and without judgment. Today, we're diving into one of the most taboo and misunderstood topics in men's health, masturbation, and specifically, what happens if you do it every day and how it affects your prostate. We'll walk through the myths, the actual science, the potential health benefits, and we'll talk about when it might be a red flag or something to discuss with your doctor. Whether you're still sexually active, not interested at all, or just plain curious. This is a conversation you deserve to have with honesty, respect, and dignity. So grab a cup of tea, take a deep breath, and let's take this step together, one fact at a time. Segment 1. What is the prostate and why does it matter? After 60, let's start simple. Your prostate is a small gland about the size of a walnut. It sits just below your bladder and wraps around the tube that carries urine out of your body, called the urethra. Its main job is to produce fluid that nourishes and carries sperm. That's why it plays such an important role in male sexual and reproductive health, but as men get older, the prostate tends to grow. This is called BPH, or benign prostatic hyperplasia, and it's incredibly common. By age 60, nearly half of all men have some level of prostate enlargement. By age 70, that number rises to 70 or even 80%. This can cause all kinds of issues. Waking up multiple times at night to pee, weak urine stream, dribbling, or that constant feeling like your bladder never quite empties. That's why today's topic, masturbation and your prostate, really matters, because this tiny gland affects your daily comfort, your sleep, your dignity, and your peace of mind. Segment 2. Is masturbation harmful to your prostate? Let's bust one of the biggest myths right now. No, masturbation is not harmful to your prostate. In fact, some studies suggest it may actually help. One of the most well-known studies from Harvard found that men who ejaculated more frequently had a lower risk of developing prostate cancer, and yes, that includes ejaculation through masturbation. The theory is that regular ejaculation helps flush out potentially harmful substances from the prostate. It keeps the fluid moving and reduces stagnation or inflammation inside the gland. In fact, the study showed that men who ejaculated 21 times or more per month had a significantly lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. So, if you're healthy and it feels good, there's no need to feel guilty or ashamed. Segment 3. When daily masturbation may be too much. No, let's be real. Just because something isn't harmful doesn't mean more is always better. Daily masturbation by itself isn't dangerous, but the reason why you're doing it, that matters. Ask yourself, are you doing it because you feel good or because you feel bored, lonely, anxious, or compulsive? Is it affecting your relationships? Is it interrupting your sleep? Do you ever feel sore, disconnected, or ashamed afterward? For many older adults, especially those living alone or dealing with loss or depression, it can sometimes become a coping mechanism. Something you reach for, not out of desire, but out of emotional needing those cases. It's not about judgment. It's about awareness. You don't have to stop, but you may want to slow down, reflect, and ask, is this still helping me? Segment 4, the prostate cancer link and the role of ejaculation. Let's circle back to that Harvard study because it's one of the most trusted and cited pieces of research on this topic. Study followed over 30,000 men. For nearly 2 decades, researchers asked how often they ejaculated, either through sex or masturbation, and tracked their health outcomes over time. Here's what they found. Men who ejaculated more often, especially during their 40s, 50s, and 60s, had up to a 20% lower risk of developing prostate cancer. Why? Researchers believe it's because regular ejaculation helps reduce inflammation. It may also lower the buildup of harmful substances in the prostate fluid. It's not a magic cure, and it's not a replacement for medical checkups, but it can be part of a healthier prostate lifestyle when combined with exercise, a good diet, and sleep. Segment 5, the emotional and mental health side. Here's something most people don't talk about: the emotional side of self-touch. Masturbation isn't just physical. It can relieve stress, help you fall asleep, and trigger the release of feel-good chemicals in the brain like dopamine and oxytocin. For seniors going through grief, loneliness, or major life transitions like retirement or caregiving, this kind of gentle self-connection can offer comfort and grounding. But if it ever leaves you feeling guilty, anxious, or empty, that's a sign to pause. Maybe journal. Maybe talk to someone you trust because you deserve to feel peace, not pressure. Segment 6, common questions seniors ask about masturbation. Let's take a moment to answer some of the most common and important questions that older adults ask. Is it normal to still have sexual urges after 60, 70, or even 80? Yes, absolutely. Your sexual desire may change with age, but it doesn't disappear. In fact, staying sexually connected, whether with a partner or with yourself, can support emotional well-being, circulation, hormone balance, and even confidence. So no, you're not too old to feel desire. And you don't need to be ashamed of it. Can too much masturbation shrink or damage the prostate? No. There's no evidence that regular masturbation shrinks, damages, or harms the prostate. However, if it's paired with pain, discomfort, or difficulty urinating, it's time to check in with your doctor. That could signal prostatitis or another condition needing care. Is it wrong if I don't feel like masturbating anymore? Not at all. Some people feel a natural decline in desire over time. That's okay. There's no right level of interest, just what feels good and healthy for you. Segment 7, signs that daily masturbation might be affecting your health. Again, masturbation isn't bad, but like anything, it can become a problem if it starts interfering with your life or health. Here are a few warning signs to watch for. You feel compelled to do it even when you don't want to. It interferes with your sleep, mood, or social life. You're using it to avoid loneliness, sadness, or anxiety. You feel sore afterward or experience pelvic discomfort. You notice a drop in energy, motivation, or interest in real connection. If any of these feel familiar, you're not alone. You're also not broken, but it may be time to gently pull back, reflect, and possibly talk with a therapist or a men's health provider. There's strength in self-awareness, and healing starts with honesty. Segment 8, healthy tips for maintaining a balanced sexual routine after 60. Let's say you feel comfortable with your habits but want to stay mindful and healthy. Here are a few simple, senior-friendly tips. For keeping your sexual routine balanced, 1. Stay hydrated. Breast fluid relies on hydration. Drinking plenty of water can support a healthier urinary and reproductive system. 2. Don't rush. Give yourself time. Gentle, slower stimulation supports blood flow, prevents soreness, and helps you connect with your body. 3. Take rest days. Even if it feels good daily, try taking a break every now and then. This gives your body a chance to reset and can actually increase sensitivity and pleasure over time. 4. Strengthen pelvic muscle. Simple pelvic floor exercises like Kegels help support the prostate, bladder, and sexual function. Yes, men can do them too. 5. Talk to your doctor if you're ever unsure about changes in your body, your prostate, or your sexual health. Don't wait. There are respectful, private conversations to be had. Your doctor has seen and heard it all, and your peace of mind is worth it. If today's video helped you or gave you a new way of thinking about your body, please leave a comment below. Let's break the silence together and create a safe space for men, families, and caregivers to talk openly and support one another. If you want more honest, science-backed tips about aging, hormones, diet, and wellness, don't forget to like this video, subscribe to the channel, and tap the bell so you never miss an update. You're not alone on this journey, and we're right here with you.